Good afternoon. Thank you so much for joining us today as we're going to talk about the OTD program at the University of Vermont, one program we're super excited that is launching this coming fall. My name is Nicola Willier-Fenton. We're going to go through some brief introductions and meet everybody who's here and can share with you the details about the admission process and about the curriculum for the new OTD program as well. So we're going to talk about that program. We're also going to talk about what we found as well is that many students maybe need a few prerequisites before applying. So we actually have a pre-OT track in our Post-Bacc pre-medical program to help students get ahead in their prerequisites in order to apply. So we'll talk briefly about that. And of course, you always want to know deadlines and logistics. So we'll go over those briefly and have plenty of time for your questions. A couple notes, the session is being recorded. Thank you for putting that into the chat. And if you have questions, please put them in the chat throughout the presentation. We have Kristen with us, who is in the chat and ready to answer any of your questions about OTD today. So as I mentioned, my name is Nicole. I work in our professional and continuing education department at the University of Vermont. And I'm very fortunate to work with Victoria as she is leading the charge to launch this new program at UVM, the OTD program. So we'll hear a lot more from Victoria in just a few minutes as our program director. And we also have Ellie with us too. We're super excited to hear from Ellie today. Ellie's joining the program as a visiting professor, associate professor, and an academic fieldwork coordinator. And she's out in the field today. We'll see her actually from her car. She's joining us because she's out there working on that fieldwork coordination for our new OT program. And as I said, Kristen also on the program is in the chat. Thank you, Kristen, for being with us and answering questions. So what is the new OTD, the Occupational Therapy Doctorate program at the University of Vermont? Victoria, let's start there. Let's give an overview about this new program.
Okay. That sounds great. So I'm Victoria Priganc. I'm the program director for the new OT program. So welcome to everyone who's joining us today. We are excited because this is the very first OT program in the entire state of Vermont. And the rumor on the street is this is the last state that does not offer any entry-level OT education. So all that said is there's a lot of excitement in the community, not only here at UVM, but really throughout the community of occupational therapists in the state of Vermont to actually have this program start. So what that means is that we have a lot of wonderful community support with our colleagues who are out in the clinical setting. And we are working with those individuals right now to really create some really fun and different experiential learning opportunities for the students. And the response to when we were reaching out to folks in the clinic has just been phenomenal. And I think it's because it is the first program and there's just a lot of excitement around that. We are an entry-level doctorate program. And our program, the way that our program was designed is when we were asked to start this program, we put together some focus groups with all of the OTs in this whole entire state of Vermont were invited to join us. And they kind of came according to like practice areas. And we sat down with all these therapists and said, okay, we're starting a program at UVM. What should this program look like? How do you think it would be beneficial for our community? What are some things that when you were in OT school that you loved, that you thought were just phenomenal? So based on all of those different focus group meetings that we had, we designed the curriculum, and we really designed it so that it's a real blend of the art and science of occupational therapy. So there's a strong science component, but we also have several courses that really pull in this creativity and innovative aspect of our profession as well. So that's kind of how the curriculum was designed, developed, and as I mentioned, we have this really strong experiential learning component to our program. And what that means is that Ellie and I are working as we speak very hard to find opportunities so that you guys as students coming into our program are getting part of your education away from the classroom and actually in the clinical setting. And we're really excited to be designing our entire curriculum around this learning and teaching belief that we have that if you are learning concepts and then you're actually seeing it and applying it, it makes so much more sense. So that's that strong experiential learning component that we're working on. And it's fun. It's really fun to think about very creative ways of getting you guys, our students, away from the classroom and actually out in some of these neat and different settings. As with any OT program, we do have 6 months of fieldwork, and when Ellie will have an opportunity shortly to talk about what that looks like. And then because we are an entry-level doctorate program, we have a capstone project and capstone experience. And excuse me, I think that this is a really cool thing about not only our program, it really is for doctorate programs, but what I think is really neat about it is that this is the time when you can actually say, this is what I'm interested in. I'd like to really focus a little bit more on this particular component of OT practice. For some, it might be very clinical. For some, it might be more research. For some, it might be more leadership. The beauty of the capstone project and experience is that it's a very individual type of opportunity for students. And some students are going to come into the program and they're going to know right away, this is really what I want to explore for my capstone project and experience. Other students are going to come in and they're not going to have any clue what they want to do. And then other students are going to come in and they're going to say, this is exactly what I want to do. And then in 4 months, they're going to change their mind to something totally different. The beauty of the capstone project and experience is we can work with all that because it's so individual. So I'm really excited about that, and I'm excited to hear some of the ideas that I know some people are going to come in with in terms of what they want to do, but I'm also excited to work with those students that really have no idea, or they think they want to do this and they might want to switch over to something else, because that's where some of the real growth and learning happens as well. So we're very, very excited about that part of our program. And then we have the bullet here that talks about how we've applied for accreditation for ACOTE, and that's all OT programs are in some form of communication with ACOTE. We are in the initial phases. We're a brand new program, but we have applied for that accreditation status and are on a very good and solid path for that at this point.
Awesome
so
news.
That's a nice little intro.
Thank you, Victoria. So much information, so many things happening as we launch a new program at the University of Vermont. Thank you so much for all your hard work to make this program a reality. And so, of course, questions then arise, well, how do I get in? What do I need to apply? So let's just touch on that for a few minutes as well.
Okay. Well, this is all the stuff that's on our website, so people can certainly, look at all this information on the website in terms of our minimum CUME GPA, Pre-Bacc GPA. The 40 observation hours, we did waive that for this cycle because it's been very hard for students to actually get in and observe due to COVID. Whether or not we have to waive that for next year, we're not sure at this point at all or not. So we are asking folks to do 3 letters of recommendation, your transcripts, and then that personal statement and phone or face-to-face interview. That actually happens through a program called Cura Talent. So once the initial application's been reviewed, strong candidates are then moved along for that next level of our interview process. So that's what that is, and you would receive a link to continue on with the interview process here to enter into the program. Our application deadline is up there, April 30th. We have the learning format on there as hybrid, online, and on campus. It is very much a residential program, but we do have every semester some online component. It's not heavy, but it is there, and it's there for the sole reason to give the students a little bit of flexibility with their schedules, so that if some people need to work, or if some people just kind of need a little to step away and do some of this coursework on their own time, we have a small component every semester built in that way. Our summer semester, our very first summer semester, is almost 100% online, and that semester was designed that way so that if we have students that need to maybe go back home and work, there's the opportunity to do that. There's a small part of that will be face-to-face, but most of that semester will be online, and that was a pretty intentional thing that we did there.
Great. Thank you. That's new information for me to learn. So I really appreciate you sharing that as well about summer, because it is starting to feel like spring. So summer is going to be here very soon. And so you walked through the requirements and a little bit of some of those steps, but maybe just let's review the steps needed to an OT CAS, because maybe some people aren't aware of what that is, but how do people then get started in their application?
So To be honest, I've never actually started anything in OTCAS. I'm always on the other end. So I guess maybe Kristen would be the one to better answer that if she knows. But I think you just set up a login for OTCAS and get started that way. And then it, I believe, just kind of walks you through what you need. And in our case, you would need the 3 letters of recommendation, all your transcripts, and then you also have to do the supplemental UVM graduate college application, which all graduate students here at UVM have to do. And then once it works its way through the OTCAS system, that's when I start to see it on my end. So I don't see the very, very beginning of that.
Great. Awesome. I want to just maybe pop back to the slide and see if we could have Ellie. Ellie, share with us more about the field work. And I know there's 2 levels of field work as well. So maybe walk us through how that's being designed and just explain a little bit more about the field work.
Sure, absolutely. So as many of you prospective students have probably done your research, and you know that the level 1 field experience is primarily observational. Within our program, every semester you will have a level 1 fieldwork experience embedded in a course that will start for students the fall of their first semester with a mental health course, followed in the spring of their first year with an older adults course. Moving into the summer of first year, there will be actually 2 fieldwork experiences, one that's going to be tied in with a cultural awareness course, and the other is more of a traditional level 1 full-time 2-week observational fieldwork experience in a setting of the student's choosing. Moving into the second year of the course, you will, the degree program, you will have a young adult course that will have a level 1 fieldwork component embedded into it. Spring of the second year will be a pediatric course with an embedded fieldwork experience. And that will wrap up the level 1 fieldwork experience in our program. Moving into level 2 fieldwork experiences, those are the traditional full-time 12-week experiences where, again, the students will, through an exact program that we have, will give the students an option of electing where they want to have those experiences. They will be a combination of a lottery and a form of matching for those level 2 fieldwork experiences. And the main goal here is to ensure that the students will complete all of the requirements for the program so that they can graduate on time, be ready at the end of those level 2 fieldwork experiences to start in on their capstone projects, which will round out the program.
So many great opportunities to get that experience out in the field. Awesome. Thank you so much, Ellie and Victoria. And as I mentioned briefly in the beginning, sometimes students come and are interested in this program, but maybe there's a few prerequisites that they just don't have. And so I just wanted to share briefly about a prerequisite fulfillment program, essentially, which is the Pre-OTD track through our Post-Bacc pre-medical program. And one of the amazing things about that is that there's a linkage with our College of Nursing and Health Sciences where the OTD program sits as well. So really great information. And if you are looking to fulfill some of those prereqs, please check out the website at learn.uvm.edu. We can put that up as well, direct link over to the Post-Bacc pre-medical track so that you can see more about the pre-OT track as well. And what are some other benefits of our Post-Bacc pre-medical program? As you can imagine, just that connection into our health centers, obviously connecting into the College of Nursing and Health Sciences, and also UVM Medical Center, which is a level 1 trauma center, and a lot of access to gain patient hours, experience, research, just really becoming embedded into the medical community here at the University of Vermont. And if you are indeed needing to get some of those prereqs and interested in the pre-OTD track, there's some really focused attention with our students there to help build the curriculum and the path that you need, choosing the right courses. It's not a regiment curriculum that you need for the pre-OT. Obviously, we're trying to get the courses that you would need to apply, but we work with you on that. And over the time that you might need it, maybe that's 1 or 2 courses a semester, maybe it's 1 a semester, just depending on what your capacity is and if you're working as well. And just lots of other things here to support our pre-OT, post-Bacc pre-medical students that you can see on the screen there as well. An application is each semester, really, there's an application to the post-Bacc pre-medical pre-OT. The summer term, we always have classes in the summer, and those are online as well, with the exception of maybe a few labs if there's a lab involved. But you can see some of the other deadlines as well. So they line up really with the semesters and the deadlines needed to start on our semester. So if you have any questions on that, if you need some of that pre-work, please let us know and reach out, and we'll connect with you as well. And again, just reminding everybody of the OTD deadlines, as Victoria said, April 30th. So that's going to be coming up pretty soon. So it gives you an opportunity to collect those assets that you might need to apply, and maybe jump in and create that account in the OTCAS as well. And if you have any other additional questions, lots of information on the website as well. And we have one of those kind of quick URLs to remember, which is the go.uvm.edu occupational therapy. That's a good one that'll get you right into the occupational therapy pages. And then August 29th is when the fall semester will start with our first OT cohort, which I'm sure is incredibly exciting. Again, just a reminder of some of that information if you do need those prerequisites, putting those dates up on the screen for you as well. I did see that question. Thank you so much for asking about international students applying to the program. And Kristen, thank you. She answered as well. We do accept applications to the OTD program from international students. I know that I'm not sure if Ellie or if Victoria who wants to answer this, but in our last info session, we had a lot of great questions about the cultural immersion course that you're developing as well. And I know, thank goodness, some of the COVID restrictions are getting loosened because everyone, we're having a much lower percentage of COVID cases here in Vermont, which is amazing news. And so I know some of, Victoria, you were saying that you have lots of plans for this course. COVID, let's see how things roll. But what are you thinking? What is the vision for the cultural immersion course?
So yeah, the vision for the cultural immersion course, that is one of the courses in the summer that there will be an online component to it, but what we are also hoping and planning to do is to have our students for either 1, 2 to 3 weeks, depending on the experience, be out in a community that really is different from the community that we're kind of embedded in with here at UVM or here in Burlington. So in some cases, this may be a travel study course. In other cases, this may be a course that does happen here in the area, working with like the refugee resettlement community or working with the VNA family room. The goal here is for students to be engaging with individuals where cultural issues, socioeconomical issues, that kind of stuff, factors into one's ability to really participate in activities the way they want to participate, and for our students to really examine and explore that. So we're pretty excited at this idea of the course. As was mentioned, we do not have the details on this thing figured out yet, and a big part of that is COVID. You know, we've all had to learn to pivot in a variety of ways over the last 2 years here. So we are going to see how everything kind of shapes up, but our plan is to try to be offering some of these very unique opportunities for the students via that class. So we're pretty excited about that. And I'm going to guess that probably within the next, handful of months, we'll have a better handle on that. The course itself doesn't take place for over a year. So a lot of things can happen and change, but it's very exciting, this idea of having a course like that, because some people have had those experiences, but I know when I was a student, I didn't. And I did some work with a group that went down to Honduras when I first graduated and started practicing. And we were a hand surgical, hand plastics team. And it was eye-opening to me how much the cultural component impacted everyday lives for these individuals in a setting that was so completely different from where I was. So I found myself thinking that I wish I would have had some of those experiences as a student, and that's what we're trying to kind of recreate with that particular course.
Great. Thank you for having that vision to be able to bring that experience you had to this course as well. That's pretty awesome. I'm just going to give a little bit more time here for any additional questions, but I was thinking about maybe coming back. Oh, great, Cheryl, I'll answer that in just one second. I want to come back to Ellie for a minute. Can you maybe share some of the different some of the fieldwork organizations, just trying to get a sense as to what are some of the options that might be out there for students as they start thinking about where they might go into the community?
Sure. Well, we've talked about how excited just the state of Vermont is about having this program, and so there are certainly going to be a lot of opportunities kind of locally, regionally, but we're also getting agreements with some national providers so that for the student that wants to have the experience of going somewhere in the country that they haven't gone before, there will be a national network of providers that we will have affiliations with that a student might, explore that opportunity. And again, those will be available to the students to kind of begin familiarizing themselves with as soon as they start the program.
Will there be listing, like will there be more information about that as people are kind of considering the program to see some of the different places they could be doing that work at?
We have, I'm trying to think, I had a slide previously that kind of identified where the current letters of intent are that we have. Those are not like the final affiliation agreement, but they are commitments from places, facilities across the spectrum of age and population demographics, diagnostic groups that were kind of by state. And so we can try to maybe show that slide up on the website as it begins to grow and develop and populate even more. But I want to say there are something like at least 14 different states with individual contracts, and then those national providers are, across the 50 states.
Awesome. Yeah, just think as we solidify some of those partnerships, that would be good for people to, just see the caliber of the opportunities that we have through that as well. So thank you so much for answering that question. And thank you, Victoria. Looks like you're answering questions, the question from a little bit earlier, just looking at the prerequisites and OTD bachelor from international. So it sounds like, Victoria, you're on that one. So thank you so much for answering that question. If there's no other questions, I think we'll probably wrap up here. And Victoria always puts, I saw you did that as well in the chat, she puts her email in there. She really is serious about reach out to her. If you have additional questions, she's happy to make a time to connect and answer additional questions. And Kristen and Ellie on the team also would be happy to hear from anybody who has questions as you prepare as well. And Cheryl, you're so welcome. Oh, another question. Would like to know how different is an OT degree and a master's of occupational therapy?
Right.
Yeah, great question as well. I'm not sure who might want to answer that.
I can answer that. So Cheryl, it sounds to me as though you already are an occupational therapist, and we can also, resume this conversation via email, or I can always give you a phone call at some point. The biggest difference here in the U.S., and I think that you may have your degree internationally, the biggest difference here in the U.S. is that the master level program or the doctoral level programs have the capstone experience and more research than the master level programs. Everything else is the same. All of the other standards are the same. So I think that, Cheryl, if I'm understanding correctly, that you have an OT degree and it's from another country, I think it may be beneficial for you to shoot me an email and you and I have an individual conversation about kind of your goals for continuing your education. That way I can get a better sense of where you're coming from. So my email's in there, and just send me a message and I'm more than happy to talk about it.
Awesome. Thank you, Victoria. You're so welcoming to students who have additional questions. And Megan, I apologize. I just missed your question, but I think there was some help on that in the chat. But just maybe, Victoria, do we want to reiterate just some of the response here? For those of us who'll be applying in the next few weeks, what would be the timeline for scheduling those interviews and acceptance decisions? Looks like she's trying to finish up the last prereq. So
Yeah.
What are you thinking in terms of timing over the next month?
Well, I think that I would like you, Megan, to definitely connect with Kristen. She's the expert on all of this. But what I do know is that it sounds as though you are still finishing some prereqs. That's okay for you to start the application process. And I probably, Kristen, please correct me if you would say anything different. I would probably start it now because it takes a little while for the application to go through the entire OTCAS system before Ellie and I actually get to see it. So even if you have some prereqs that aren't done, there's a way to indicate that, or you can email Kristen and let her know what you're still working on. But I think I'd probably start the application now. That gives it time to get through the entire process.
Awesome. Great. Thank you for asking that question, and thank you so much for answering that. I can't scroll down on the questions. Are there any additional questions that I need to? Nope. Looks like, thank you so much, Kristen, for jumping in as well. And if there's any additional questions, please do follow up. Email is in there. You can also reach us at learn@uvm.edu, and we can get you over to the OTD team. But I know we have to wrap up because I know Victoria has a hard stop here at 12:30. So thank you, Victoria. Thank you, Ellie. Thank you, Kristen. Thank you, everybody who has joined us, Megan and Cheryl, and everybody who has been here today. We wish you best of luck as you apply to the OTD program. We can't wait to see everybody in the fall. Have a great afternoon.
All right. Thank you.
Have a good day, everyone.